Welcome everyone. We'll be starting in just a few minutes, and actually less than 3, and we'll be sharing some of the first outputs of the COVID-19 Peer Hub. Since July 27th, more than 3,900 immunization practitioners have come together to work together to keep vaccination going during the pandemic. And thank you, Kamal Lawal. I have no doubt that you are very interesting, but perhaps you meant this is very interesting. I don't know which one it is. Maybe you can clarify. And please do tell us what city and country you are connecting from. So we'll be starting in just over 2 minutes. Stay with us, and we'll be looking at your comments and questions as we go. Warm welcome from the Geneva Learning Foundation. I'm Rida Sadki, and very happy to welcome you on the 14th of September for this global event. This means that the General Assembly of the COVID-19 Peer Hub, which happens every Monday, is now happening. And if you are following us on Facebook, please let us know where you are connecting from. Share your city and country, and we'd be happy to share this as we just did for Ian. All right. So, what are we up to? We are celebrating the collective effort of health workers all over the world who continue to work every day to protect children from vaccine-preventable diseases during the pandemic. More specifically, since on July 27th, over 3,900 immunization staff from 96 countries came together in the COVID-19 Peer Hub to share experience, spread ideas, and take action to keep vaccination going during the pandemic. Let's go to Alain Blaise-Tatsingou, who's been one of the leaders of the COVID-19 Peer Hub. Alain Blaise-Tatsingou, how are you? And what would you like to tell us about today, where we're going to be listening to the voices of participants in the Peer Hub, sharing some of the first outputs?
Hey, good afternoon, Reda. So I'm very, 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 very excited to be here and really happy as well. So today is the second week of where we are sharing something that I think is very important to those who are in the room. We are sharing the experience. We are sharing what we've done during the 6 weeks. So I'm really excited to be here to really listen about how that project that we developed is intended to enhance our contribution to the response of the COVID-19 as scholar. We are going to take it. So yes, I would like to congratulate all of you who were able to complete the action plan. I'm looking forward to hear the insightful, all what you gain from the ideas engine, your participation with your colleague and your peers, and looking forward to see how that will help to actually take action at the field level. So thank you very much, Breda, and nice to be here.
Wonderful. Thank you. Shalini Kare from India is also with us. She has also been helping to lead the COVID-19 Peer Hub. Shalini, what would you like to say? What's on your mind today? As we've got a 2-week pause in which we have begun to share some of the outputs of the Peer Hub.
Thank you, Rada, and hi, everybody. Good morning, good afternoon, and good evening to you all. And Rada, I'm extremely excited. These 6 weeks have been phenomenal. And the experiences that the scholars wrote about in the ideas engine and the projects they did were absolutely phenomenal. And I'm hoping to hear about their experiences and how they found the platform and how they shared their experiences with their peers and about their actions. So it's really great to be here and to hear all of you. Thank you, Rada. Over to you.
Thank you, Shalini. Charlotte Mbu is currently on leave this week, but she'll be back next week, and we'll hear from her as well. So just a reminder, and for those of you who are joining us on Facebook, perhaps for the first time, 3,904 participants were selected to join the Peer Hub on the 27th of July. And here, a reminder, I shared this last week as well, 96 countries, and you can see large numbers of applicants and from some countries, and a fairly selective process. Most participants from the Ministry of Health national and subnational levels. And very quickly, within the first 2 weeks, this initial group, the enthusiasm, the energy, the challenge of figuring out how to keep vaccination going during the pandemic led to the generation of more than 1,200 ideas. Now, this I said last week. What's new this week is that we have the final number of action plans that have been produced. And altogether, it's a round number, which is pure coincidence. We have submitted 700 action plans to describe and to describe the actions needed in a specific context to keep vaccination services going. Now, this is not some click-through exercise or some, this was intense thinking, reflection, analysis, context analysis, and then followed by peer review, the peer-reviewed part of the exercise. That meant figuring out how to give feedback to others on how they could improve their action plans to keep vaccination going, and reciprocally making sense of the feedback received from others. Now, just a quick point of order. Some of you Anglophones are starting one of two courses. There is the WHO Scholar Level 1 Certification in Routine Immunization Activity Planning and the course on Electronic Immunization Registry from the Pan American Health Organization. So I'd like to say, if you have been selected for either of those courses, we have planned for that, and we will be able to accommodate your continued participation in the Peer Hub. And you will be able to opt out of some activities if it's too much. We urge you to prioritize the courses themselves, but ultimately we trust you to make the right choices that will be reasonable and that will make sense for you in order to continue to complete the courses and complete the activities that you choose to participate in the Peer Hub. Now, the big news this week, what we didn't share last week, is actually the results by country of the Peer Hub participation in Exercise 1. So altogether, we have 700 people who have submitted a final Exercise 1. But then here are the Francophones. So that's why this slide is in French. You can see the countries here. And in some cases, a few people who are from English-speaking countries or who speak English might have sort of registered themselves for the other language. But you can see the numbers here. And For the Anglophone countries, I'm going to move myself out of the way so you can find your own country on the screen and see how you did. Now, there's 8 people who did not register their email or used a different email, so we're reconciling those. I think Minja and our team has already figured out who they are, but these are the final numbers. Now, for the action plans. Now, the action plan was the most intense part of this sort of stage 1 of the Peer Hub. And what we'll be doing, I'll be explaining this on the next slide, is on the 24th of September, we'll be actually holding a commencement ceremony. It is the commencement, the beginning of the Peer Hub's action. And on the 24th of September at 6 p.m. Geneva, right after this meeting, you'll be receiving the email with the invitation and with a link to register yourself if you want to participate in this. And that is the occasion upon which we will very solemnly award the certificate for Peer Hub Exercise 1. And everyone by that point will have already started with the second part of the exercise. Now, before we get to the commencement exercise, and if you were here last Monday, this is repeating some information. I'll go quickly so we can get to the presentations of the action plans. But it's important to really look at your schedule, look at what's realistic, figure out what level of participation you're going to be able to commit to in the coming weeks. So many countries, there's been a lot of energy and enthusiasm and hard work on building the country team of participants in the Peer Hub. So on the 18th of September, we'll be holding a meeting for team leaders, focal points, but also for all participants who want to support their team leaders and focal points. So you'll be receiving that information as well in an email right after this meeting. And that, following this, we'll have a procedure which we'll explain during the meeting to formally recognize these country or national teams. Now, if you've been following us on Facebook, you know that 3 times last week with Charlotte and Boo, we actually did a daily ideas bulletin in which we invited a member of the Peer Hub who had completed their action plan to share their action plan, but also share more about their context, their experience. We were able to ask some questions as well as participants on Facebook. So that is going to continue to actually resume starting on the 21st. We'll keep doing those. We have 700 action plans, many of them, surprisingly, with information, contexts that's simply not available anywhere else. So we'll be sharing them. That's one step in which we'll be sharing back with you, and other immunization practitioners will be through the Daily Ideas Bulletin. Now, the main feast is on Monday. Starting Monday, we'll be kicking off the Launch Pad. So again, the email you're going to receive, don't miss this one, is going to explain how you're going to join the Launch Pad and what exactly is it. I'd like to turn to, to Mohammed Imran Qureshi from Pakistan to explain to us. He was a participant in the Impact Accelerator Lunch Pad in July 2019. Imran, welcome. I hope you have recovered from your birthday, and we'd love to hear what, could you tell us and could you explain to fellow participants in the Peer Hub what exactly is the COVID-19 Peer Hub? And specifically the Launch Pad.
Thank you very much, Rida. And warm welcome to all the colleagues from around the world. So first of all, COVID-19 pandemic was a huge public health challenge for all of us around the world. So no country and no community was spared from this menace. But the real solution for such a huge public health challenge was their need for a important launching pad from where we could summarize all of the challenges we are facing and look forward. What is the way forward? How we can just contribute together towards a common solution? Instead, we could say the problems which are varying to some extent in certain communities, how they can figure out what actually we need to do to overcome all of these challenges. And immunization is the best public health product. So how we can reach to the last child, even during this COVID-19 pandemic, whereas to address the concerns of the mother and the caregivers and provide the due vaccination, which was really required. So as I already said, that the children of the world need all of us more now as compared to the past. So this platform, Geneva Learning Foundation, provided us this COVID peer hub where we can like sit together and figure out, find out, and develop our own action plans in the exercise one, where we could like summarize what is the main immunization challenge and to figure out that particular challenge, what is the background of this challenge, and what actions are really required to address this immunization challenge. What are the concrete actions which we can take and address this immunization challenge? So I believe during the past few weeks, we are able to develop such a strong action plans that can be utilized by different immunization programs in different countries, by which they can like counteract the situation and hope so that they could recover from this COVID-19 pandemic and resume to the business and try to reach to the children which they really require in order to save them from all vaccine preventable diseases, from cases, from outbreaks, and in a larger way from the mortality and morbidity, just to reduce the mortality and morbidity from vaccine preventable diseases. So in short, we all are contributing to this COVID-19 pandemic challenge and the way forward. Over.
Thank you very much, Imran. So very quickly, starting on the 21st of September, there is not going to be a new project to do. There's not going to be any kind of coursework in any way, shape, or form. Instead, we'll be asking you to set a goal for this period of 4 weeks. You decide what the goal is in relation to your action plan, and then we'll only ask you to check in. How is it going? Have you made progress? Have you had a success? Have you had a challenge? Have you had a failure, perhaps? And then during the General Assembly, we'll be hearing from each other about these successes, challenges, and so on. And we'll be encouraging you to connect with others when it makes sense to do so during this period of 4 weeks. It's after this launchpad that we hope this process will help you accelerate your progress with your action plan. In fact, in July 2019, when we checked in 6 months later and we compared people who had participated in the Launchpad versus people who did not participate in the Launchpad, the difference was that people who did participate were 8 times more likely to have made significant progress toward implementation of their action plan in that context. So that is really what the Launchpad is about. Shalini Kare was actually in the Launchpad in July 2019. Shalini, would you like to share what is your recollection? What did you gain by participating in the Impact Accelerator last year?
So it was a very exciting platform where we were asked to implement our projects. And what my takeaway was that you can really work along with your country teams, and you can come up with one focused plan. And if it works out, then the scale at which you can implement your plan is superb. So I would recommend to all the scholars who are from various countries to work together and see if it's possible. But if it is not, then they should continue to basically work towards their plans and how they're going to execute them. And this is a great opportunity for you to think through and to achieve your goal. So that I think is a really, really good opportunity for everybody.
Thank you.
Yeah, thanks, Reda.
Thank you, Shalini. I see Sajal Dutta has a hand raised, and you're welcome to use the Q&A tool. But let's go to Sajal and see what I'm asking you to unmute, Sajal Dutta. So I hope your microphone is ready. We would love to hear from you, of course. Okay, looks like that might be a mistake rather than an intent or a request to speak. So remember, use the hand raised icon only if you actually want to speak. We might just turn to you and ask you to do so. And we will in a couple of minutes. So 2 more things, which, yes, I'm repeating from last week, but we have some new people who are following us on Facebook, a significant number, in fact. So with respect to Teach to Reach, and I know many of you in the room are Teach to Reach Level 1 certificate completers, we'll be holding a pilot conference on the 12th of October, and then to cap, to sort of round out or close the year on the 8th of December, large annual conference. Why is this relevant to the Peer Hub? Because country teams will be invited to hold their own workshops within this fully virtual conference that will have a plenary, large number of rooms for workshops, as well as networking features that we hope to bring to scholars and to immunization practitioners. So that is for the Teach to Reach conference. And then last but not least, the Peer Hub Exercise 2 will kick off on the 2nd of November. And that will be, we will be opening up the Peer Hub again for a second intake of participants. And it will then be, obviously, we'll focus using the peer review project methodology. This time, everyone will be asked to focus on this question of vaccine acceptance, vaccine hesitancy, demand, call it what you will, but you are all being confronted by this issue on a daily basis. And so we will be dedicating the last part of the Peer Hub this year to this question through another exercise. So that's the plan, and you'll be receiving right after this assembly. You'll be receiving an email with the full details. I encourage you to read that email carefully. Alain Blaise, what would be your advice when, in some cases, participants receive many emails? They seem to have become quite adept at figuring out what's important and what's not. What is your advice?
Yes, Breda, thank you very much. My advice would be really to have the email, do not turn down the notification, because in fact, emails that are provided, none of them is like just an email for the sake of sending an email. Some of them are, all of them, the course team is taking all the time, because we really know that you're busy professional. So our aim is to provide you all the support that you need. If you take 5 minutes, only 5 minutes to read through the email and use all the link in there, then you are saving a lot of time. So my advice would be really to make sure that you receive all the email inbox, and when you get one, go through it, read it, and having in mind that any email is to help me. We are not generating information in email, but it's really to take action and make sure that you are up to date with the course. So that my general advice would be really, if you are in the P Hub, make sure that all the email for the P Hub, you go through all of them, because they are there to help you to succeed in your task at hand. Thank you, Reda.
Thank you very much indeed, Alain. As for Julian Awuma, who says hello back to you. And I'd like to ask you if you could let us know also what city and country you're connecting from in a comment, as well as if you have any questions. So we are on Facebook Live today because and so this General Assembly is being shared because we are beginning to share the outputs from the first 6 weeks of the Peer Hub. All right, so this is the recap, as well as some additional information about the final results for the for Exercise 1. And so now over to you, participants and members of the COVID-19 Peer Hub. We'd like to ask you to raise your hand if you'd like to take on these, answer these 5 questions, asking you about your experience of the Peer Hub, and then asking you also about, obviously, questions 3 and 4 are specifically about your action plan. Okay, thank you, Julian, from Cameroon. Thanks. So we are going to ask you to raise your hand, and we'd like to ask, see if there are participants who have not yet, or who have never perhaps spoken in a General Assembly. I'd like to encourage you, really encourage you to do so, and to raise that hand way up high so we can hear your voice and get to know you as well. So we will start with Amsalou Shifaro, and I want to encourage you to, and I hope the connection is with you, Amsalou, today.
Thank you so much, Rada. Can you hear me?
Loud and clear.
Yes, thank you so much. And I'm Amsalou Shifaro, joining from Ethiopia. I am working as immunization officer for UNICEF country office. So the first question is, what has changed for you through the participation in the Peer Hub? I think I can say I have able to learn from ideas engine, different experience in the ideas across the countries as well as across the level of healthcare. national, subnational, and service delivery level, and it enriched or broadened my thinking about immunization in the context of COVID. And number two is the project development process, including the rubric guide, peer review, and the feedbacks from colleagues helped to refine my project as well, project proposal, and improve the quality and I can say appropriateness and applicability of the project as well. Number three, the most important one was also the enlightening session, particularly the 4 or 5 WS questions from Dr. Francois, Charolette, and Rishalini, and other colleagues as well, helped a lot to deepen our analysis and also sharpen the plans until I am confident that I can do and how to do. I'm confident how to do as well as when and where to do. So the enlightening sessions were very important, and it definitely helped to sharpen my plans. The second question, do you plan to go? Yes, I want to continue as much as I mean the time allows me, and it's an important and interactive and learning experience. It provides us different experience from different participants and scholars as well as facilitators. So it is very helpful, and I will continue to participate on this. Number three is mainly on the challenges that I worked. The challenge was actually the primary healthcare level service providers are skeptical to properly practice and adhere with infection prevention and control, as COVID-19 is continuing and its dissemination is also not improving, and health workers are susceptible, mainly as they are providing service for the public, and particularly the primary healthcare level or frontline health workers are mainly skeptical because they are not managing actually exclusively the COVID cases, but they are providing other essential services. And there are some preliminary data that indicated those health workers working in non-COVID health treatment centers are infected, and this will definitely disseminate the COVID, as well as it will overstrain the health system. And then it is critical to take care. So my goal is to improve the IPC perception and practice at least by 30% by end of this year. Currently, I don't have the baseline data, but some of the field observations indicated that the frontline health workers are skeptical to use the face mask as well as hand sanitizers while providing services because of different reasons. And I just developed the plan to improve the perception and the use and adherence of IPC practices among the frontline health workers. The concrete actions that I plan to do are three mainly. Number one is ensure the availability of PPE, particularly face mask and sanitizer at primary health care level, and work with the stakeholders, including the Ministry of Health and pharmaceutical supply agency to avail the essential supplies at primary healthcare facilities, and conduct rapid assessment on availability and use of face masks to establish the baseline. And then at the session level, we encourage health workers to swap immunization sessions to mainly to more ventilated areas. It could be outdoor, it could be wide rooms, but it has to be well ventilated and enable them to keep physical distances. And then the other is encourage health workers to properly use and adhere the practice of particularly face masks and hand washing or hand sanitizers. And number two is conducting risk communication on COVID among frontline health workers, including the local data on the prevalence of the COVID among the primary healthcare level health workers, and incorporate on any trainings the WHO guidelines on the use of IPC and conducting immunization in the context of COVID, and use of social media platform like telegrams to disseminate key messages. The third key action is incorporate IPC supplies, availability of IPC supplies and use in the monitoring checklist, and conduct around 10 immunization session monitoring, and then collect data and provide feedbacks. And number three is collect qualitative and quantitative data and provide feedbacks for health workers as well as for health managers to improve the adherence and use of IPCs. Number five, how can the peer hub help you? I think the peer hub can help, as I have said, it definitely helped to improve the plans to ensure applicability or appropriateness, and it's also good to monitor the status as well, whether these plans are implemented and what is the status, what are the challenges that we face during the implementation, because saying is not, doing is not as easy as saying. So it is very important to monitor, to give feedbacks, as well as to learn from others as well. Thank you, and over to you, Rada.
All right, thank you very much indeed. François Gas, are there any comments or feedback you would like to give on this action plan? It sounds to me like Amsalou Shifaro did work with you in the daily sessions you organized with Charlotte and Boo to support the development of the action plans.
Thank you, Reda, and hello to everyone on this call. First, I said I have not much than to congratulate Amsalou for such a detailed action plan in a very difficult context, and be so specific about the challenge, the action toward the challenge, and the action step to make the challenge occur, and to monitor if the action step are implemented, and if he's making progress over time in having the protective equipment on the face of all the workers of the front line. And he has shared a lot during the lightning session of the challenge when you work in a very hot climate, when you don't see around a lot of COVID cases. You wonder why you should wear those very inconvenient masks during the heat. And I would say that his plan is it's just extremely specific, and I'm happy that he's going to implement it, and looking forward to see how he implements it and what results he's getting. And I'm sure all scholars will learn from him sharing his implementation of the plan that he has carefully crafted in a very, very nice way and very convincing way. Thank you, Reda, and congratulations again, Amsalu, for your project, which makes sense. And if I was a donor, I would fund it. Over to you, Reda.
Thanks a lot, François Gas. We actually had on the French call with the Francophones, one person who is the EPI manager for his country, who's decided to, following consultation, of course, who's decided to fund who secured funding for his project. Having just a technical glitch that may take a second or so to catch. Yeah, we don't want to be watching the video. We want to share yes, here we go. All right. Thank you very much, François. So just a quick recap for those of you who are following us on Facebook. We need the next volunteer to raise his or her hand. And I especially encourage participants that we have never heard from to speak and to share share their work, answer the questions that were up on screen. And for those of you who are following on Facebook, if you're not entirely sure what this is a COVID-19 peer hub. So on July 27th, over 3,900 immunization staff from 96 countries joined together to share experience, spread ideas, and take action to keep vaccination going during the pandemic. So let's go back to the questions. You have the questions in front of you. I'm going to paste them in again. And really the next 28 minutes are going to be dedicated to you and to hearing your answers to these 5 questions. So you can share with us about your experience of the Peer Hub, as well as present and summarize the main points of your action plans. And we know that if you are in this room 7 weeks after the beginning of the launch of the Peer Hub, it is almost certain that you did in fact submit so I have Ochuole Barca, who says the best program I have experienced. Thank you for the kind words. Thanks for this experience, Ochuole. I don't believe we have ever heard from you, perhaps in one of the daily sessions. So I'm asking you to unmute, and we'd love to hear your answers to these 5 questions. If you are able to speak to us. All right, and I know Sajal Dutta had raised a raised hand earlier. So Sajal, if you'd like to go, and what I'm going to do is we're going to put on a little bit of music while you find your motivation, and really we want to be encouraging and encourage you even if you've never spoken before. Well, that is the voice that we'd like to hear. I'm going to go to Marta Ngoe and ask Marta, do you remember the first time that you spoke in a scholar meeting, and how did you overcome? Did you have any, sort of reservations or concerns before you spoke up? Welcome, Marta. Are you able to speak to us?
Hi, everyone. Thank you.
Yes.
Thank you, Reda, for giving me the floor. Okay. My first time on speaking in a scholar meeting. Actually, it was a good experience. I didn't have any panic because on the background I've been working with my peers from the very first scholar course I took. That was the GRIPS level 1. So we have been having this interaction, though not physically most of the time, but online. So it was not really a big deal for me to talk in the scholar community as a whole, the global scholar community. So I didn't really have any panic with that.
I understand, Martha. What would you say to someone who is in the room? They have completed their action plan. They've worked hard for the last 7 weeks, but they're a bit shy, or they're feeling they're not quite comfortable speaking in this way. What would be your words to them?
Okay. I know they are there and they have wonderful action plans that they have developed for the past 7 weeks. And I don't want anybody to feel shy. I will encourage them to come up with their actions plan that they have developed. If there is anything, we are in a community where our contributions count. If there is anything that needs to be improved on that action plan, together we will do that. And at the end of the day, we'll be happy because that action plan will go further, not to only create an impact in their community, but in their country and also the world as a whole. So I encourage those who have developed their action plan not to put them under the table, but they should speak out. That's another form of advocacy, and we're here to contribute so that that action plan can be implemented. Thank you.
Thank you so much, Martha Ngoe from Cameroon. So, all right, in the meantime, several hands went up and microphones unmuted. So let's start with Mary Goretti Otieno. Mary Goretti, are you there? Are you able to speak to us, please?
Yes, I'm available. Thank you so much, Reda, for the opportunity. The experience has been awesome. We've managed as a country to use youth to volunteer to help us map out the areas and the families who are in need of vaccination. And this has worked a lot. Remember, it was a challenge to have the elderly in the workforce, that is 58 and above. They were told to go on leave, and this made the health workers reduce significantly. And areas where the immunization was wanting was hard hit. But with the idea of youth volunteering and mapping, it has worked well, and we are good to go. And as a team, we are now coming up with the one idea or two ideas so that we can achieve the goal we were aiming to achieve in our country. And we had a meeting on Friday with Alain. It was well done. Thank you so much. It is a wonderful experience and an honor to be in the peer hub. Thank you. Keep it up.
Thank you, Mary Goretti Otieno. Could you tell us where you work, which country, where in the country, and what your role is?
I am from Kenya. I'm a researcher. I observe things from the background and offer my advice. I came to learn about peer hub, not the peer hub, but the challenges we had for immunization before COVID because of the areas I was working in. I'm a lecturer. I work at the university. I'm at the Women Study Center. So matters of women and especially immunization is close to my heart, and I do a lot to champion using the community. People, the women I work with, they're the ones I use to champion these causes, and it has worked very well. Thank you.
And Mary Goretti Otieno, could you tell me, can you think of something that you learned during the Peer Hub from interacting with immunization staff, so people who really do the job of reaching children and ensuring that they have all the vaccines that they need? If you are a researcher, you're not working as immunization staff, what did you learn from those interactions?
I've learned a lot that the people on the ground have taken their work seriously. I also learned a lot during the coffee. I was hooked with somebody from India and somebody from Nepal, and we shared a lot. And right now, I could see the enthusiasm people had on this. And if people work like that as a team, we are going to prevent very many diseases which are there in Africa, including COVID.
Thank you so much, Mary Goretti Otieno. Glad to hear that Alain is part of your support team, as he is for so many others. And thank you again for raising your hand. We have now many hands raised. So I'm going to go to Abdullahi Balarabe. Abdullahi, are you?
Yeah. Good evening to everyone.
Yes, we hear you loud and clear. You have 5 questions before you.
Yeah, good evening to Balarabe Abdullahi from Kaduna State, Nigeria. Actually, I was very, very excited about the way this program is being handled. Of course, there is a lot of improvements in the area we operate, especially when it comes to demand creation of the regular immunization. So basically, one of the major challenges we faced some few months ago was the fear of the people, fear of contacting the virus during regular routine immunization. Of course, through community enlightenment, we have been able to record a significant improvement. And then there's a peer scholar who shared his idea with me some few weeks ago, telling me that there's hardly a lot of security challenges, and of course we were able to challenges. The guy was going through and advise him on the need that needs to be improved. And of course, since that time, we were able to communicate.
Okay, I don't know about everyone else. At least I've lost Abdullahi Balarabi, unfortunately. Abdullahi, are you still able to speak to us? And can others confirm in the chat if that you've lost him as well? Okay, yeah. Thanks, Sahini. Okay. All right, we'll come back to you, Abdullahi. Of course, it's regrettable when this happens, but we got the gist of it. You did not introduce yourself, though. So I'm going to ask, let's see who is, I'm going to ask Olubowale Ekundare to speak next, hoping that the connection will be with you. Olubowale, how are you doing? Please don't forget to introduce yourself before you answer the questions. And we've had more problems than usual this Monday with the francophones, so there seems to be probably networking issues in many different countries, and of course we know it very quickly, being connected to everyone everywhere through the Peer Hub. Let's try Atahir Abubakar. And oops, oh sorry, I have.
Hello?
Yes, Atahir?
Yeah, good evening, Rita. Good evening, how are you? Yeah?
Yes, we hear you loud and clear, Atahir. So you are a hyperactive scholar. You're active on many fronts. Remind us, don't forget to introduce yourself, even if we already know you, and then tackle the 5 questions.
Yeah, I'm Atahir Abubakar from Nigeria, working with National Primary Healthcare Development Agency in Zamfara State as a technical officer supporting routine immunization. What has changed for me through the participation in the Peer Hub, a lot of things has happened. I have now learned to work together with people, to have listening ears, and there's a way you can support your peer. Using the technical session by Dr. Ellen, I've learned a lot, and the daily session by Charlotte. So based on those things, I have learned to interact with my colleagues a lot, and I've deployed that strategy in my place of work, where we have started seeing some changes in just 2 weeks that we started deploying that kind of technical session to solve some problem from facilities. Then secondly, do you plan to continue? Seriously, Peer Hub will be my second home from now on, because I've learned a lot, and I will continue learning from Peer Hub. My challenge, as I mentioned that the last previous time, is the availability of PPEs in hard to reach areas where caregivers find it difficult to have PPEs, so they keep on sharing face masks between them. Someone will go, if one has, then they will be sharing the PPEs. If you access service, when you leave the facility, you issue it to somebody, then it will come and access the service in the same facility. So we are trying to have face masks available in all 3 points of our hard to reach facilities, and we have so far so good. Out of the 320 facilities that in hard to reach, we are able to push face masks to like 118 with support of some partners. Then what concrete action do you plan to take in coming weeks to achieve the goal? One of the concrete actions is to make sure PPEs are available, and we have liaised with the state COVID-19 committee, and we have a meeting with the chairman, who they have provided us with some face masks, and so I even work with some private organizations which have also supplied face masks to us, like 10,000 pieces of surgical masks. So those are the steps, engaging various stakeholders, so that we can have preventive PPEs. Then, okay, how can the hubs help you? This kind of situation, this kind of meeting will help in addressing a lot of our challenges. where we can present our findings, our challenges, and reader and the other participant and the anchors will give us a feedback, and so that we can improve where we have lapses. Thank you.
Tahir Abubakar, thank you very much. Let's go to our next speaker. Let's go to Obed Nuobe from Ghana.
Hello, Rida.
Yes, Obed, good to hear your voice. We hear you loud and clear, maybe a little faint. If you can speak up or increase your the volume of your microphone.
Good afternoon, everyone. I'm Norbert Philip Obed, connecting from Ghana. I'm a health information officer, and precisely I work at Ahanta West Municipal Health Directorate in the western region of Ghana. We've just finished with our SIs to help improve the immunization in our country with respect to the circulating polio drive that is affecting our country. And we are happy to say that in the municipality we have improved in our coverage. As at day 4 yesterday, we've been able to hit 100% coverage. Straight to the questions that have to be asked. The first one has to do with what has changed for you through your participation in the peer hub. Indeed, the peer hub has given us new ideas, innovation strategies that can be employed to carry out SIAs, routine immunizations. In fact, I see the peer hub as a repository that has a lot of information. Once you get in there, you have most of the information that can help you to improve your routine and outreaches and whatever immunization in your country. And I think that is one of the areas that I want to dwell on. And if nothing at all, the peer hub has actually helped me to be more focused, and I've been able to come out with a project that I'm actually working with seriously. And then also, in fact, it has also assisted us to be able to give appropriate feedback to our peers and those working in the peer hub. The second one has to do you continue to participate in the peer hub? Yes, because of the level of support we have and the knowledge that is being shared. New documents are being shared, and we learn those things, and it's helping us to be able to improve in our immunization coverage. The next one has to do with what is the challenge and goal you have set? Is this in line with your EPI? The challenge that I had, that I worked on, has to do with Penta-3 coverage in Aguna sub-municipal in Ahanta West decreased from 54.2% in 2019 half year to 44% in 2020 mid-year. And we associated it as a result of the COVID-19 pandemic. And this Penta-3 coverage in our municipality has never declined for the past 4 years, but it happened for the first time in this year, and we associated it to COVID-19. And clearly, and what actually happened was that Aguna sub-municipal had a high number of COVID cases during the pandemic. And even the just ended SIA, we also saw it again, that there were a lot of caregivers within Aguna sub-municipal that felt that we are trying to probably bring in COVID vaccines, despite the intensified health education that went on. And we saw that still the coverage compared with the other 4 sub-municipals, though they had about 96%, but we believe that they should have done better, looking at the way we intensified the campaign in Aguna sub-municipal. So my goal is to improve on the average pentathlete coverage per month from the current 7.3% we saw as at June. For every month, we saw 7.3% instead of 8.5%. And that is what we hope to achieve, that every month from September, 1st September to December, we'll be getting 8.5%. And once that is done, then we'll be able to hit the target for the year. And the next question has to do with what concrete actions do you plan to take in the coming weeks to achieve this goal? We've already done the briefing to our municipality, and they are all aware about the program that we involve ourselves in. Fortunately, my director happens to partake in the peer hub, and then the municipal EPI coordinator is also currently with us, and even in this very room with us. And we are all planning together strategically to be able to get all the children that have been missed. The next coming weeks, because of the SIA, we planned carrying out, trying to list all the children that have defaulted pentathlete coverage. We are using pentathlete as a proxy to be able to get all the other vaccines that they have missed. And we planned this meeting from on the 7th, but because of SIA meetings, we have moved the meeting to next week. And that is one of the things that we want to do. We also intend creating a platform that will help us to be able to track the pentathlete coverages or vaccinations that are done every week, not waiting until the end of the month. And we intend carrying out monitoring to all the vaccination sessions. And one thing we've seen in Aguna sub-municipal is that the sub-municipal is big and more communities have come up, which some of them are not in our micro plans, and we intend going to the ground to look at all those streets that have come up to be able to map out wherever these children are missing. So basically, these are some of the actions we are taking, and we are going to intensify publicity on that, which is already going, but we are going to intensify publicity. Then lastly, the question has to do, how can the peer hub help you carry out these actions to reach your goal? Indeed, when you look at the support on actions, the support that is normally provided during a peer hub meeting, if it is not working well and you share it with the group is ready to help you to think through your actions. And looking at the expertise we have here, I don't think we can fail in any way unless you are not connected. Once you are connected, appropriate feedback will be given. And because we continually give constant feedback to the peer hub, we will know that we'll be able to make progress in that direction. And I am sure with this, I'm ready to partake in the Accelerator Lunch Pad that will be launched. Thank you very much, Rita.
Thank you very much, Obed Nuboe from Ghana. Just a quick question, Obed. I know you participated in the Launchpad in July 2019. Can you explain for new participants? We have about half of the participants who had been scholars already, but the other half, this was their first experience. So could you explain for them what is the Launchpad? That is going to start on Monday, the 21st of September.
Thank you very much, Rita. I think the Launchpad basically is looking at your project that you have developed, and within a scope of, say, a month, look at the plan carefully and see those actions that you intended to roll out. Which ones can you roll out within that specified period, that within the 1 month, and be able to implement them so that it can be measured with, and at the end of the day, shared with the community. That is the General Assembly, during General Assembly meeting, and it's something that we can feel it. Maybe if there are meetings, if there has to be a particular training you want to do, Within that scope of 1 month, if it's going to be launched, you look at the project and see what you can you can tease out from your project and then implement within that short period. That is basically what the Launchpad, Accelerator Launchpad is all about. And to be able to continue monitoring your plan even after the Launchpad, to be able to get the desired results that you intended for. Thank you very much, Rita.
Thank you very much indeed to you, Obed. That's a very clear explanation. It's also that the Launchpad will be open primarily or almost exclusively to people who have completed their action plan, because that is what you're going to take the action plan and set a specific goal for the next 4 weeks and go for it. Just go to achieve that goal. I see a couple of questions I'd like to answer. One from Dr. Isha Goyal, who says, can we have the names of the participants who have earned certificates? So you'll be receiving, if you have earned a certificate, you'll be receiving an email shortly after this General Assembly, and we'll be actually awarding certificates on the 24th of September at 6 p.m. Geneva. That information and the registration link will be included in the email that I've referred to several times during this session. So I hope that's an adequate answer. Dr. Tanushree Mondal, many of the participants of Scholars India team have missed giving the reviews in the final version were to be given by the 5th of September. Can you please reconsider for us scholars who missed the opportunity? Unfortunately, we feel the deadlines were clear. We did extend by 1 week. Of course, the point is not to penalize people needlessly with formal requirements. But in principle, we already extended by a week. And actually, because we are preparing these certificates starting today, we certainly would encourage you, certainly would encourage you to submit late. Better to submit late than not submit at all, and to complete your reviews. That's it for today's assembly. We've got 2 minutes left. I would like to see, let me see. So we're not going to have time to hear from anyone else. Let's close here then, and let's go back. Just a quick recap of what exactly is the Peer Hub. So it is, for those of you who are following us on Facebook, the point is to share experience, spread ideas, and take action to keep vaccination going during the pandemic. What you heard today were some of the action plans developed by participants in the Peer Hub who drew on the ideas engine. Over 1,200 ideas generated by immunization staff from 96 countries. Now, here you see what is coming next after the Impact Accelerator Lunch Pad, and that will be exercise 2 on communication, negotiation, and community engagement. So that is it for today. Let's go back to the music. Thanking you all for your participation today. All of those who are following us on Facebook, thank you. Don't forget to like or add hearts, whichever seems more appropriate. And we look forward to communicating with you this week and reconvening on Monday, this time to launch the Impact Accelerator Lunch Pad, starting Monday for 4 weeks before we then go into the exercise 2. Hope you're finding this useful. We'll be asking you for feedback, so please do complete the feedback. Let us know how we're doing and how we can do better. Thank you and goodbye.